Welcome to the 2019-2020 Suicide Prevention Training that is being provided to staff district-wide. This presentation was developed by your Pleasanton Unified School District social work team, and we are so passionate about getting this information to you. We really believe that it is imperative that anyone working with our students has this education so that we can best meet the needs of our students. We do recognize that this can be a very sensitive and heavy subject, and we hope to address it in an informative way. If at any point in this presentation you're feeling overwhelmed or triggered, please feel free to take a break, and we can always follow up with you after to ensure that you have the tools that you need to move forward with suicide prevention efforts at your site. We're not going to spend a ton of time going over data, but we do want to kick off our presentation by reviewing some basic facts about suicide to give you a framework. Unfortunately, suicide is the third leading cause of death for young people ages 10 to 24. This is exactly why this presentation is being shared at all schools across the district, grades K through 12. Although many people make the assumption that this is just a subject that needs to be covered at the high school level, we know all too well that students starting at age 10 and even under struggle with suicidal thoughts, and so that includes elementary, middle, and high school. For every one completed suicide, there are 25 attempts. We don't always hear about attempts because some students may never share with anyone, or their parents might very well know that they made an attempt, but they don't want to share with the school because they're concerned about their child's privacy, and there's still a very strong mental health stigma in our community. One person under the age of 25 completes a suicide every 2 hours and 11 minutes, so that's roughly 3 students throughout the course of each school day. And 4 out of 5 students who attempt suicide have given clear warning signs. This can seem like a really overwhelming statistic, but this is actually a good thing because it means there are things we can look for in order to be proactive in a preventative sense. And lastly, the rate of suicide attempts is 4 times greater for LGBT youth and 2 times greater for questioning youth than that of straight youth. So as our culture changes, we need to be aware of this and the fact that our LGBTQ students are at a higher risk. Next, we want to take some time to review some common myths surrounding suicide. The first one is that talking about suicide will plant the idea in a student's head. However, the truth is that asking questions uncovers suicidal thoughts so that you can get them the help they need. Talking about suicide really needs to be destigmatized, and it's something we need to ask about directly. Research shows that asking someone about suicide doesn't actually increase the likelihood of them making an attempt. The next myth is that someone who talks about suicide is just trying to get attention. The truth is that although sometimes students do talk about suicide as a way of getting attention or trying to get out of something, we need to take it seriously anytime a student talks about it because it's always going to be better to be safe than sorry in this circumstance. The next myth is that if someone wants to end their lives, there is nothing that you can do to stop them. However, the truth is that we know based on brain development, many students can act impulsively to harm themselves. So if we can help students to slow down and get them the treatment they need, they actually have a really high chance of recovery. The next myth is that depression causes all suicides. And the truth is that not everyone that struggles with depression is suicidal. There's other disorders that can contribute, such as substance abuse, anxiety disorders, schizophrenia, and psychotic disorders, to name a few. It's also important to keep in mind that adolescent depression doesn't always look like sadness. It can oftentimes look more like irritability, and we're going to talk about that in some future slides. And lastly, there's the myth that we touched on earlier that young children cannot be suicidal. However, the sad truth is that more teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease combined, Even young elementary age children have reported thinking about suicide and make attempts, sadly, sometimes completing these attempts. We have seen this here in our district. We know that this is something that is true for our community. A lot of people ask the question, what causes suicidality? And it's a loaded question because there's no one known cause, but rather a merging of these three factors that becomes overwhelming for a student. And the three factors that we're going to touch on today are health factors, environmental factors, and historical factors. When we're talking about health factors, there's several things we're referring to. The first is we need to be aware of mental health disorders. So 90% of individuals who've completed a suicide had a treatable mental health disorder. It's really important to emphasize that it was treatable. So if they had gotten the care that they needed, things may have ended a different way. Substance abuse disorders are another thing to pay attention to, because although many students try to cope with depression by smoking weed or using other drugs, it actually makes the depression worse, and students who are under the influence are more likely to make impulsive decisions. Students that have serious or chronic health conditions or pain might feel hopeless and depressed. Traumatic brain injuries and smoking can be health factors to keep in mind, and then antidepressants. It's really important to emphasize here that antidepressants don't always cause suicidal thoughts, but one of the risks of taking them is that if they're not a good fit for a patient, they can cause suicidal thoughts. That's something that the doctor will always warn a patient about if they're prescribing an antidepressant. However, we have a lot of students in our district that are on antidepressants and it has been life-changing for them. So we are not saying antidepressants are bad, we just want people to be aware that one of the side effects of an antidepressant that is not a good fit for a student is that they might have suicidal thoughts. When it comes to environmental factors, some of the things that we want to be aware of are access to lethal means. So students that have access to guns can be at a much higher risk. Bullying, prolonged stress, stressful life events, a lack of social support, exposure to another suicide is a big one. So we need to be really careful with how we respond to a completed suicide at school, because if a student is struggling and they see their peer that died by suicide as a hero, they may be tempted to follow suit. We also need to be aware of the stigma associated with mental health, barriers to accessing services like counseling, and then certain cultural or religious beliefs can promote suicide as an honorable way to die. Hopelessness or tunnel vision, and then gender confusion, as we referenced earlier. When it comes to historical factors, we need to be aware of previous suicide attempts a student might have made, if they've engaged in self-harm before, if they have a family history of suicide, if there's been any past abuse, if there's been any recent or serious loss, if there's been involvement in the juvenile justice system or child welfare system. I like to note when I'm talking about recent or serious loss that this might be the death of someone, like losing a parent, but it could also be the death of something as they knew it. So maybe a recent move, so the death of that old life in the town they used to live in, or maybe their parents have gotten divorced and so it's the death of their family as they knew it, or a recent breakup. I mean, that is a real grieving process for a lot of our students. I also like to note that just because someone has these historical factors does not necessarily mean they're going to struggle with suicide. It's just something to be aware of. Risk factors versus warning signs can be a little confusing, so we want to provide some clarification. Warning signs are going to indicate that a student is at an immediate risk of suicide or a risk in the near future. However, on the other hand, the presence of risk factors suggests that a student is at a heightened risk, but not automatically in a crisis that requires immediate attention. So in other words, risk factors increase the probability that a suicide will occur, but they don't mean that it's imminent. Whereas warning signs, however, do indicate that a suicide crisis may be actively happening or will happen in the near future. So we use a yellow light of like, slow down, be cautious of the situation for risk factors, and then a red light, a blaring red light for warning signs. There are three main genres of warning signs that we're going to be talking about today, and that's talk, behavior, and mood. Just as a reminder before we dive into this area, Your job is simply to keep an eye out for these warning signs or red flags. You're not responsible for actually counseling the students. When students talk about these things, we should be very alert. So feeling hopeless, threatening suicide, stating they have no reason to live, sharing that they're feeling like they're being a burden to others, feeling trapped, unbearable pain. We always want to make sure that any talk about suicide is always taken seriously. When it comes to behavior, there's a lot of things to keep an eye out for. So reckless behavior, stops or starts taking medication abruptly, if you find them searching online for materials or means, if a student is withdrawing from activities, so maybe they used to be on the soccer team and they've just stopped participating, or they used to play the guitar and you just have heard them mentioning that they just stopped playing any kind of musical instrument. Isolating from family and friends, sleeping too little or too much, eating too little or too much, the obvious things like visiting or calling people to say goodbye, giving away prized possessions, aggression, writing or artistic expressions of death. This is a big one that teachers say that they have seen signs of in student artwork or essays or poetry. This could very well come out. And then neglecting personal responsibilities, such as not taking care of pets, no longer submitting schoolwork that they used to be really good about submitting. When it comes to moods, we want to keep in mind things like depression, as we mentioned earlier, extreme mood swings. Extreme mood swings can be kind of humorous when we talk about adolescents because if you've worked with adolescents at all, you know that they all have them. We just want to be noticing when a student is deviating from their typical moods. Anxiety, loss of interest can be a sign. Irritability and agitation are big ones. So a lot of times we picture depression as someone that's really like low affect and like down in the dumps. But a lot of times for children and adolescents, depression manifests itself in irritability and agitation. If someone is constantly acting like they're humiliated or they have a lot of rage or seeking revenge, or extreme distress followed by a sense of peace can be concerning because it could mean that they've figured out a solution to their distress, and that solution in their head might be suicide. Although this is a dark and heavy subject, the good news is that there's a lot of protective factors for students. Protective factors are the factors in one's life that can work to overcome struggles, challenges, and even reduce the negative consequence of some of the risk factors and therefore the likelihood of suicidal behavior. When our social work team was reviewing this list of protective factors, we were actually really encouraged because we noticed that a lot of these protective factors are things that Pleasanton Unified is already implementing on a number of different levels. So the first one, access to mental health care. This is part of the reason that we have counselors and district social workers because we're working on helping families to access mental health care. For family engagement, we have parent liaisons at each school site from lots of different cultural backgrounds to support families in engaging. We have peer support, positive behavioral interventions and supports. PBIS is all about helping students to feel connected to school and community. Problem-solving skills. You might think that teaching a student how to solve a really challenging math problem has nothing to do with suicide prevention, but if you can teach a student how to work through a really difficult problem and use life skills for that, they're going to eventually be able to translate those life skills into their everyday life outside of the classroom, and when they face challenging circumstances, they're going to be more equipped to cope with those. Self-esteem and cultural and religious beliefs are protective factors as well. So research shows that students who have something bigger than themselves that they believe in are more likely to have hope in life. Self-care. This is a big thing that our district is moving towards is we're trying to work with staff to talk about what does it mean to take care of ourselves so that we can be most present for our students, because our students are watching us and we set an example for them. So if we're taking care of ourselves, our students are going to be more likely to practice healthy self-care. Restricted access to lethal means is something that we're working on educating parents about. Purpose in life. A lot of teachers give wonderful assignments about what is your purpose in life and what are your dreams and aspirations, and these are all things that can help instill that sense of hope. And then lastly, positive connection to adults. So, as teachers, you are in and of yourselves a protective factor. Any school staff member is a positive connection to an adult. So, as you can see, we have a lot of protective factors here at play in Pleasanton Unified already. There's a number of preventative measures that you can take as a teacher. The first and obvious one that so many of you are already doing is to create a safe environment in your class. So, letting students know that they can approach you for support. We can also prepare students in advance when there's going to be a speaker or a video or a book that might be emotionally triggering for them. Lastly, don't let assignments be anonymous. A huge problem that we're finding is that teachers allow anonymous assignments and then they're at home at 6 p.m. They're grading papers and they see something really concerning that a student wrote and they're having to shuffle through all these papers and compare pieces of work to try to identify handwriting and identify who this at-risk student is. Next, we want to give you some really clear guidelines of what to do if you're concerned about a student. So, first step is just keep an eye out for those red flags, the talk, behavior, and mood signals that we talked about earlier. The second is reach out. If you have concerns about a student, pull them aside privately and ask them directly, are you thinking about killing yourself? If you don't feel like you have that relationship with a student or you're not comfortable asking that question, we want to encourage you to refer them to counseling, and the counselor will be able to ask those questions as well. The third is listen to their story without trying to immediately help. We never want to promise confidentiality. It's very tempting because students will ask us all the time, can I tell you something if you promise not to tell? The answer is no when it comes to suicide. We can never keep that a secret because we are legally liable for them and we want them to be alive. And so if they need help, we need to tell the appropriate people to get them help. And then lastly is trust your gut. Assume you are the only person who's going to reach out and report that a student is at risk. So it's really important that you escort the student to the school counselor or the psychologist or the admin immediately. Do not email or wait until the end of the day to call, because we've had issues where teacher or staff member calls and leaves a voicemail on the counselor's office phone or leaves an email not knowing that they're out that day or that they're in another crisis. And so that student's needs are not made aware, not brought to the counselor's attention until the next day or until it's too late. So if for some reason you can't leave your class, please call up to the office and get an escort. We want to make sure that you actually talk to a physical person and get the student support right away. A lot of school staff have expressed that they don't feel comfortable directly asking, are you thinking about killing yourself? Because it just seems so abrasive. It is a strong question, but it's really important that we use that direct language because there's a big difference between asking the question, are you thinking about hurting yourself, and are you thinking about killing yourself? Those are two very different things, and we need to be explicit in the way that we ask because we're looking for a very explicit answer. Another reason people have expressed concern about asking that question is they don't know how to respond. What if the student says that they are? What do you say? These are a few response statement ideas that we want to share with you. We always want to emphasize that just like anxiety can be contagious, keeping a calm demeanor can also be contagious. So make sure that you're remaining calm so that you can help the student remain calm. So a few examples of response statements you could use are, thank you so much for trusting me to share, or I'm sorry that you're feeling so overwhelmed, or it sounds like you have a lot going on, or let's keep you safe. These are all going to communicate care to a student. So what happens if you ask a student and they refuse to answer or they refuse to share? First step, just share what you observe that has concerned you. So maybe it's that they used to be a really hardworking, focused student and you've noticed they've just totally given up. They don't even attend class anymore, or maybe they're not turning in work anymore. You've noticed that they don't spend time with friends anymore and they've stopped playing on the soccer team, something like that. Share what's concerning you. Share those red flags that you've noticed. And then let the student know you and other adults are available to go to for support. Remind them who their counselor is, remind them where the counselors are located, make sure they know how to get support. And then lastly, give them the suicide hotline numbers for after hours. These are the numbers that we encourage students to call, and please remind students that these numbers are all listed on the back of their ID cards. Okay, so a student does share with you that they are thinking about killing themselves. What happens next? We want to share with you some of the behind the scenes PUSD procedures that are going to happen so you have a big picture of what's going on. The first step is that a counselor is going to speak with a student to assess risk and see if they need to be formally evaluated for suicide risk. Next, a trained school resource officer, so one of our SROs who's part of the Pleasanton Police Department, is going to do a formal evaluation with the student. Third, if the student is deemed to be at risk of hurting themselves, parents are contacted and they're going to be placed on what's called a 5150 or a 5585 hold, and they'll be transported by ambulance to a hospital. So a 5150 or a 5585 is a psychiatric hold where the student is hospitalized, and this hold is placed by the police, not the school. Fourth is that the student is going to receive treatment at the psychiatric hospital, and they will be released when a medical professional evaluates that they are stable. Upon leaving, the student is actually going to be given what's called a discharge plan, and that's going to outline recommendations for how to support the student in the home environment and moving forward in the school environment. And then lastly, when a student returns to school, they have a re-entry meeting with the counselor to talk about the discharge plan from the hospital. So teachers will be provided with info on a need-to-know basis because we understand that it is important for you guys to know what's going on, but we also need to keep in mind that we have to be respectful of the family's privacy, and so we may only be able to give you so much information at times, but we are trying to keep you in the loop so that you can best support your students. We've gotten the question a lot, what about after hours? Sometimes you're at home grading papers and something pops up and you are suddenly concerned, or maybe you're laying in bed at night and you're thinking back on a conversation you had with a student and you just do not feel steady about it. There's something concerning. We are going to encourage you to call the Pleasanton Police Department at 925-931-5100 for a wellness check. I'm going to encourage you guys to take out your phones right now and put this number in there so that you can use it if a situation ever arises. If you do end up calling for a wellness check, I'm going to encourage you also to email the counselor at your school to let them know that you made the call, but assume that they're not going to see this email until they've returned to their office for normal working hours. It's just helpful for them to know if a wellness check has been made. Also keep in mind that this is confidential. If you have a wellness check done, it will be confidential, although students may be able to deduce who made the call based on information they've given you. Similarly to an oxygen mask on a plane, it is vital that you take care of yourself before you can be there to support students. We want to end our training today by just covering some basic self-care tips for you. The first is if you're involved with a student who's shared that they're feeling suicidal, or if you've had the unfortunate situation of having a student that died by suicide, just acknowledge that this was an intense event for you. This is a lot to deal with. Next, we encourage you to talk to someone about what it was like for you, either a colleague, a family member, a therapist. If therapy is something that you're having a hard time navigating, the district social workers would love to help you secure mental health services if that would be helpful for you. Next, we encourage you to allow this to be a team effort rather than getting over-involved individually. And lastly, recognize that you are not responsible for another person's choice to end their life. Thank you so much for your time and your attentiveness to this presentation. We hope it was informative, and we encourage you to reach out to our social work team, your school counselor, your school administrator if you have any additional questions about how you can best be providing suicide prevention support at your school site.